And we're live. Welcome, everybody. This is Dr. Sarah Merritt with Lifestream Health Center. We are your pain management specialists in Bowie, Maryland, making acute and chronic pain management caring, accessible, patient-centric, and evidence-based. Today, we're going to talk with Dr. Ed Wing. He is an experienced obstetrician and gynecologist with a practice treating many aspects of women's health. And today, we were discussing that we may be able to introduce him in some of his practice and better understand pelvic pain, heavy bleeding, and some other topics. So welcome, Dr. Wing.
Thanks. Glad to be here.
Yeah. Thanks for being here. Well, tell me a little about your practice and how did you get interested in obstetrics and gynecology in the first place?
Not sure. My practice is a general OBGYN practice with a focus on helping women with heavy bleeding problems. And we have been a practice for 10 years now in Suffolk, Virginia. Now, most people don't know where Suffolk, Virginia is, but many people know Virginia Beach. And so we're about 2 cities west of Virginia Beach.
Okay.
And how did I get into OBGYN? Well, that's a long, drawn out story, but I think the summary version of it is that I was really impressed with the diversity of things that are done in the field. So I get to deliver babies and take care of moms during their pregnancy. I get to do primary care type things, and I get to do surgery as well. So I get kind of a little bit of everything.
That's fantastic.
That was appealing to me.
Yeah. And you really probably take care of women through a lot of their lifespan potentially also.
I do.
Yeah. I think that's, I can relate to that in the sense of one of the things that I appreciate about pain management has been, just the ability to, have those longitudinal relationships with patients, or if you're working in an acute care setting, you may miss out on that sometimes. Well, that's great. So tell me about, I think that's really interesting that you have a focus on heavy bleeding, because that seems to me like maybe a condition that doesn't always get the attention it deserves. I mean, it can be pretty disruptive for patients. So how does one get diagnosed with heavy bleeding, or what does that even mean?
Yeah. So, I think one of the good starting points for talking about heavy bleeding is talking about what's normal. And, a period is usually described in 3 different, aspects. One is the frequency of the periods. And so, a normal period occurs every 23 to 35 days. Now, that's a big range there. But anywhere within that is considered normal.
Okay.
The duration of the bleeding is between 3 and 7 days.
Okay.
And that's considered normal. Again, a wide variation there. And then the amount of bleeding is measured in milliliters. So 80 milliliters of bleeding over the entire course of the menstrual cycle. So 80 milliliters is about a third of a cup. And so, that's not at one time.
Yeah.
But that's throughout the whole period. Excuse me. And so, anything up to that is considered normal. So, I think one of the things that I've seen, I saw it in a patient today, is that oftentimes women will put up with a lot of things outside the norm. Like they think that that abnormal is normal. So, I've had patients who have bled every single solitary day. Could you hear me?
Oh, it just blanked out for a minute. But patients that have bled every single solitary
every single day for 3 months, and they didn't seek care because they thought it'll go away eventually.
Okay.
And there's kind of this. I don't say this is everybody. Everybody is different, but
Sure.
there are some women that just learn to put up with the abnormalities of their periods. And
Sure.
the sad thing is, in one of my patients that I was just thinking of that had that kind of 3-month bleeding, it's totally destroying her life.
How's that?
She has trouble going to work because
Oh.
she's bleeding so much. She has to leave early. She calls out. It's messing up her relationship with her partner
Sure.
because it's very
Interferes with
undesirable to be intimate
Sure.
when you're bleeding. And so 3 months is a long time for no intimacy.
And so what do you do with that patient? What are the steps? Is there a workup to figure out the cause of that profoundly continuous amount of bleeding, or
absolutely?
what do you do?
And I think one of the key things is to share the normal values with her, so that she understands that yes, you've been putting up with this, but it's not normal.
Yeah.
It's not normal what you're experiencing, and to kind of start from there. In terms of the actual medical workup, we first try to find a cause of that type of heavy bleeding, and that's going to involve a couple of different things. One is a history, just listening to what the woman tells you. You can oftentimes make the diagnosis without doing anything else, just by talking to the patient.
Yes.
But then there are tests that are done. We do a battery of hormonal tests to look at the hormones that either cause the periods to happen or have an effect on the periods. And an ultrasound is a very important tool that we use to make diagnosis. The ultrasound is great for picking up structural abnormalities, like tumors or changes in the size or shape of the uterus.
And you can do that just in the office on the day of a visit.
Do.
Yeah.
And one other tool that we have in the office, which is actually a fairly new thing, is hysteroscopy. And what that is a procedure where we use a very skinny telescope that we can actually put into the uterus. It's done through the vagina into the uterus, and we can actually take a look around and sample the tissue inside the uterus, called the endometrium. That's the tissue that bleeds every month. And so we can really get a view of if that tissue is normal. That's something that we couldn't do in the office previously, or it wasn't done very, very often. I'll put it that way.
And what's changed that's allowed to happen now, I wonder?
Technology.
Oh, okay. Very good.
Technology.
And the patient doesn't need to be asleep for it, I guess, is the other.
No, they don't.
That
and actually, they tolerate it very well.
Yeah. Yeah. Super interesting. Well, that's huge, really, that that the technology has advanced to that point that, hey, you don't have to have a surgery. We can do an exam in the office and get a look at everything just right here.
Yes.
Awesome. Very good. So this is super interesting to me, because I think I have absolutely had the experience as a clinician of speaking with a woman about pain and what's going on in their life. And they might say, man, I have been bleeding every day this month. And, at some level, just A, knowing that that's happening, but B, what advice should we give those folks as clinicians? See your OBGYN, I imagine would be the main one.
I think, I say that, but I really do say that, because I think the OBGYN is positioned to not only be able to diagnose it, but
Hmm.
to be able to treat it in multiple different ways.
Yeah.
I have a lot of the family medicine doctors who will work with the diagnosis, and then they'll use medical means to treat it.
Yeah.
And sometimes the patients do just fine with that. But they may do better with other modalities that they wouldn't even have heard of from the family medicine doctor. So it's I think because we have such familiarity with it that we can
Hmm.
really just you know just really get into the treatment and offer a lot of other things. I get referred a lot of patients from family medicine doctors,
Yeah. If
and
they know
so
you're interested
that's
in them.
fine,
Yeah. Yeah.
and I'm not using that to bash anybody,
Oh, right. Right.
but I'm just saying.
Yeah. I think, and let's talk about like what are the treatments. So we talked about the diagnosis. If someone has
Mhm.
heavy bleeding, we're going to talk about the what's normal and anything outside of that 23 to 35 days, more than 3 to 7 days at a time. Um, then that person might need to have an ultrasound and or a look inside the uterus with the minimally invasive type of hysteroscope, to look. And then depending what you find, what are the treatments?
Yeah. So the interesting thing is that each patient comes in. I'll kind of limit it to the ones that are experiencing the bleeding. They know they're experiencing the bleeding, and they really want it to stop, and they want something to make it stop.
Yeah.
I have people that have a wide variety of views of what they would like to use for treatment. So I had, for instance, a patient that had fairly large fibroids.
Hmm.
Those are tumors of the uterus, and usually we treat those surgically. But she wanted to use uh, kind of an alternative medicine treatments for that, with different supplements and vitamins, and changing her diet and the things that she's eating, to
Sure.
try that and see if that works.
At least try that first, maybe.
Yeah. And that's completely reasonable. And
Yeah.
a patient like that has an appointment to come back to see me in 6 months, and we see what progress that she's made.
Wow.
I've had patients who walk through the door saying, "Dr. Wing, I don't want to hear about any other treatment except hysterectomy,"
Right. Yeah.
and they're just ready for that
Yeah. I'm just
procedure.
done with this body
Yeah.
part. Yeah.
And then I have other patients that say, "Dr. Wing, I don't want to hear anything about hysterectomy. I don't
Hmm.
want that."
Yeah. Yeah.
And so, I
So you're not a
work.
one trick pony, is what you're telling me.
I am not, and I'm also very attentive to the patient's desires and
Sure.
what they want to get treated.
Well, that's
I
good
have some
medicine, right?
patients. I'm sorry.
That's good medicine, right?
Oh, absolutely.
Yeah.
I have some patients who want their periods. They
Hmm.
just want them to be
Right.
nicer, and that they would be, uncomfortable not having a period.
Hmm.
And I
Yeah.
have patients that I come up with a way that they, don't have to have a period anymore, and they're just surprised that that's even an
Is
option
that
for them.
possible? Yeah. Who knew?
Yeah.
Yeah.
And so
Yeah.
the
The person's individual values are going to really,
that is right.
impact the right treatment for them.
But I have this thing that this saying: effective treatment for heavy bleeding is life changing. And if
Yeah.
we can find an effective treatment, it's just amazing the changes that these women experience very quickly, very
That's awesome.
quickly. Can I tell you a little story? It's a
Oh, yeah.
story that's dear to
Oh,
my heart.
story time. Yeah.
One of my patients, I think she had a hysterectomy, if I remember correctly. And I saw her in post-op period, and she was doing great. And then I saw her a couple of months later, and she came into the office, and her hair was all done up in, nice style, and she was wearing makeup. I mean, she was
Yeah.
always dressed, nicely when she came to the office. But she looked like she was going out someplace.
Mm.
And I remarked to her and I said, "Oh, look at you, what?" And she's like, "Yeah, I just put this on, kind of, way of describing it." And we went through the thing, and I asked her, "Oh, how you doing?" And she's like, "Dr. Wing, that was the best thing I ever did. I haven't had any bleeding at all. I feel more energetic. I feel like my blood count is back up, and, it's just great. And I can do all of these things. I got rid of all of my sanitary napkins and, pads and tampons and all of those things."
Mm-hmm.
And as we're talking, I looked at her and I said, "Oh my gosh." And she's like, "What, Dr. Wayne?" I said, "You are wearing a white pantsuit."
Oh, yeah.
And she just busted out in tears. She just was weeping. And she's
Wow.
like, "I've never been able to wear white clothing before
Yeah.
because I've always been afraid that I'm going to have an accident and
Oh
it
my
would
gosh.
just be so embarrassing." And so, such a simple thing, I
Yeah.
mean, just being
Yeah.
able to wear light clothing, but to
Right.
these women, it's just, it's something that they've never,
Yeah.
experienced
I never
before.
thought
And
of
it's,
wearing that white pantsuit before, but now I'm going to.
oh yeah. And the confidence that, she had just coming into the office, she was really a changed woman because of
Wow.
that.
Yeah,
And,
no, I think that's
but,
amazing for quality of life to you know, improve like that, just to where it's just not a worry if that's something that's been disabling or limiting
yeah.
patient. Yeah, that's great. That's really great.
Mhm.
Um, I think that's really interesting that you mentioned there might be a place for supplements or things like that if a patient you know, were ready to make some changes but wasn't ready for a procedure or other types of treatment. Tell me about what kind of supplements might be helpful in this condition if
Yeah.
somebody has heavy bleeding.
So definitely, I look at the supplements as, kind of a side therapy,
Hmm.
and, something to do along with, medical type
Yeah,
therapies.
a complementary
So
approach, maybe.
definitely things that improve the blood count,
Hmm.
making them less anemic. So your iron, your vitamins, having a once a day, multivitamin is very important,
Okay.
in iron. We also know that, the some of the most common cause of heavy bleeding is hormonal causes. Um, Polycystic ovarian syndrome is probably the most well known of those
Yes.
hormonal problems that cause problems with periods. Um, and we know that the polycystic ovarian syndrome is a vicious cycle, because what happens is, obesity is one of the parts of that cycle.
Hmm.
And, the obesity, makes you insulin resistant. The polycystic ovary syndrome makes you insulin resistant,
Mm.
which makes you gain more weight, which makes you more insulin resistant,
Oh yeah,
which makes you gain more weight,
it's a tough cycle. Yeah.
and it's just this cycle
Yeah.
of making you worse. And the periods are, a part of that. Hirsutism is another
Mhm.
aspect of it, where women have hair growth under their chin. I've seen, women with hair growth under their chin that they actually have a beard.
Oh
Um,
goodness.
you
Yeah.
know, Usually it's not that bad. Usually it's kind of just, some, I call them squiggle hairs, little
Sure.
tiny hairs under the chin. But, and most of the women are, just they shave because they don't want it, want it there. So, in that particular case, definitely the diet,
Hmm. So for polycystic
provides,
ovaries,
yeah,
dietary
yeah,
change.
it,
Yeah.
it provides a breaking point.
Hmm.
And by losing weight, that's one of the ways to kind of reverse the cycle.
Mm-hmm.
And sometimes just by losing, 10% of the body weight,
Mm-hmm.
sometimes that is enough to make the periods improve.
Yeah, tip the balance a bit.
Mm-hmm.
Yes, I've definitely seen that with my patients also, and can try to use that for motivation that, hey, you don't have to, you don't have to lose every pound there is to lose. It's just a matter of optimizing a little can be enough to make just those huge differences in quality of life.
So that is definitely something, I have yet to see, the evidence to prove it, but I would think a lot of these medications like Wegovy and Singulatin, like they may help with the polycystic ovaries, because it definitely helps with insulin resistance.
Mm-hmm.
And it may also help by just the weight loss that occurs, and appetite suppression with those types of medication, which is something that can help. It's not going to get rid of the problem, but I think it's something that could be used as an adjunct to it.
Mm-hmm.
So I have my ears and eyes open for that one, and actually I might go ahead and use that with a couple of my patients.
Yeah, that's right. I was going to say, do you refer patients if you think they would benefit from weight loss to a weight loss clinic, or do you work with patients yourself in that regard if they need that as part of their plan?
I don't work with them myself, just because at this point in time, at least, I'm not set up to do that. I do have some colleagues that work with weight loss. We have a colleague that does it online, and so that might be something to think of to send that patient to her.
That's great.
Yeah.
Well, and tell me also, is there a higher? I was just thinking about who gets who suffers from heavy bleeding. We discussed sometimes it will be associated with excess weight, but not always.
Yeah.
Is that correct?
That's correct.
Okay. But I think, is there a higher incidence of heavy bleeding in the African American population?
I haven't heard a higher, but it is very common.
It's common.
And I would say, there's probably a higher rate of not getting effective treatments for it.
Sure. Yeah. No, I think that's potentially a real problem for sure. Very good. So the risk factors overall for heavy bleeding primarily would be excess weight. Are there others? I guess hormonal imbalance.
Hormonal imbalance definitely would be one. And then there's, there is a familial, component to it.
Okay.
For instance, with fibroids, it's very common for that to exist in families.
Okay.
And I have patients who come in all the time that tell me, yeah, my mother had a hysterectomy, my two sisters had hysterectomies. I'm the only one who has my uterus left, and I have heavy bleeding now.
Mm-hmm.
And, so there's definitely a genetic component, or I'll say a hereditary component to it.
Got it. And so a lot of those patients who develop heavy bleeding, is that going to be in perimenopause, or it might be during those childbearing years? Is it at any specific time?
It's variable.
Okay.
It's variable. I would say a lot of women have, the problems during, that 35 to 50 year frame.
Okay.
Because there's just a lot of changes that happen in the march towards menopause. That's what I call it. There's just a lot of different things that happen. The ovaries aren't as consistent with ovulating every month, and that just leads to a lot of different things.
Interesting. Yeah. So just changes maybe some of the environment there.
Mm-hmm.
So interesting. And do you work with patients for hormone treatments as well? It sounds like.
I do. So the hormone treatments, are for the most part medications that we might use for um, birth control.
Okay.
As a matter of fact, using birth control pills is a very common one, especially in
Yeah.
younger women. And in all of the cases, it doesn't get rid of the problem. The problem may be PCOS, or the problem may be fibroids, or the
Mm.
problem may be,
Yes.
endometriosis or adenomyosis. And so, there is nothing that really eliminates the problem. It's really to manage the
Control the symptoms.
symptoms
Yes.
as like a chronic
Yes.
illness.
Yes.
And as long as the treatment goes on and the symptoms are, managed, the patient can have a normal life with, I'll say a normal period, but at least a period that they can live with. And
Yeah.
then at menopause, everything changes because the periods go away. And, there menopause, that's a whole nother conversation
Whole other
that we could
conversation.
have. But at least in terms of heavy bleeding, the bleeding goes away.
Yeah. Now, are heavy bleeding type of periods generally more painful than a regular period? Do you hear that? Is that a big part of the discussion, or is it really just the continuous bleeding that's more what drives people to treatment? I wonder.
So I think that there's definitely a pain component to heavy bleeding. I think the degree of it really depends on what the cause of it is.
Mm-hmm.
So structural type things like fibroids or adenomyosis, they tend to have very painful periods. Where when they have a period, they can be like incapacitated by the pain that they would have with that. Hormonal ones are usually not as bad, but there is a condition that's just called dysmenorrhea, or painful periods, that doesn't have anything to do with the amount of bleeding that you have. That is sometimes an underlying condition with the heavy bleeding. So you get rid of the heavy bleeding, but the patient still has painful periods, and so it is associated with it in many cases, but then there are other times where it's not
always perfectly correlated. Yeah.
Mm-hmm.
Yeah. I think it's really interesting. In the pain literature, as I'm aware of it, sometimes I talk to women who have chronic pain. These are my patients, and if they're still having menstrual cycles, I'll talk to women who will feel like their pain level is worse in general during their menstrual cycle. And the literature, that we have in the pain field really bears that out, actually, that, we're more sensitive to pain around our periods, which is just crazy to me. Is this something that OBGYNs talk about also?
I think so. There are just all these, and you could probably tell me a couple of things about this, but the pain pathways, in the pelvis are just very, very interesting. Just how it works. I can give an example of endometriosis, which is a condition where the cells of the lining of the uterus, are outside of the uterus where they don't belong.
Yes.
And when we do surgery and we see endometriosis, it could look like a little dark dot.
Yes.
That's like a couple of millimeters in size. The less than an eraser on a pencil.
Yeah.
Smaller than that.
Just tiny.
And the patient can be debilitated by that little thing.
Yeah.
And it's just, it's not a very big thing. It's not sometimes it goes deep into the pelvis, and that's part of the issue. But it's just the way that the nervous system of the pelvis is. It just somewhat, amplifies, the pain, pathways, when there is a problem there.
For certain times. Yeah.
And,
Yeah. It's That's so interesting. That's just so interesting to me. And yeah, to your point about, yeah, these little things can be so impactful. Let's, yeah, Dr. Wing, thank you so much. I think I have asked most of what I wanted to ask. Are there any other updates or anything else that you want to leave us with?
You know, I think we had a great discussion about these things. You know, the the thing that I would say is that you know, in the case of a patient with these problems, to really, I have patients that actually come in and they tell me, oh, I'm having heavy bleeding because my ovaries are, you know, enlarged. And, you know, I look at them and I say, well, how do you know your ovaries are enlarged?
Right.
Oh, because I feel heavy in my left side. And, you know, I say, oh, okay, yeah, well, we'll need to look into that. But, you know, you can't really tell,
Mm-hmm.
you know, what it is that's causing it. You know, you have to be evaluated, you know, for it. And you know, we're set up to help our patients with that. You know, our we have a clinic in um, our practice
Mm-hmm.
that's set up for that. We bring the patient in, and we have very lovely, compassionate staff,
Mm-hmm.
you know, that work with me, you know, with these patients, and you know, we try to give them hope, you
Mm-hmm.
know, of just getting better in this area. And you know, oftentimes just the workup is not extensive. As a matter of fact, I can get it done in a week, you know, and well, most of the time. And once we do that, we can come up with a treatment fairly quickly. And so I would just, you know, encourage the people that are listening that have that problem
Mm-hmm.
to seek out care. We're around, you know, for anybody who's
Yeah,
in the southeastern Virginia area, you know. And
absolutely.
I have had patients, you know, come from, you know, far distances.
Sure.
I actually had a patient from your neck of the woods in Maryland who
Mm-hmm. Mm-hmm.
had come to our practice, and she wound up having treatment, and she did really well.
Absolutely. That's great. Yeah, I think it's so important to find somebody to connect with to, you know, help with these issues. And I'm just glad to have you tell us more about what you do and how patients can help themselves and by seeking out care, getting consultations if they're outside of those normal ranges. Okay, so people, I wrote it down here. More than normal bleeding is 23 to 35 days apart for 3 to 7 days. So if you're outside of that, I think it's time to consider a consultation. All right. Well, Dr. Ed Wing, thank you so much for being here and
It's my
appreciate
pleasure.
your time and all the discussion.
Great.
Okay.
Thank you very much for having me.
Thank you. All right. Take care.